Have you ever wondered whether stopping masturbation as you get older could affect your health? Many people over 60 quietly ask this question but feel too embarrassed to bring it up, even with their doctor. Some believe abstaining improves health, while others worry it may harm the prostate, sexual function, or emotional well-being. The truth is far more interesting than most people realize, and it's backed by science rather than myths. In today's discussion, we're going to separate facts from fiction. You'll discover what really happens to your body when you don't masturbate in older age, how aging naturally changes sexual health, whether avoiding masturbation increases health risks, and what truly matters for maintaining physical and emotional wellness later in life. Some of these answers may surprise you because they're very different from what you read from chapters. Stay with me until the end, because the final point explains the single most important factor for healthy aging, and it has much less to do with masturbation than most people think. Here's the expanded version of Keynote 1 in approximately 200 words, with no subheading and no concluding sentence, as requested. One of the biggest misconceptions about aging is that every older adult must continue masturbating to stay healthy. In reality, medical research does not support that idea. Masturbation is a normal sexual behavior, but it is a personal choice rather than a medical requirement. Some people continue to enjoy it well into their 70s, 80s, or beyond, while others gradually lose interest or simply choose not to engage in it. Both experiences can be completely normal. As we age, hormone levels naturally change, health conditions may develop, medications can influence sexual desire, and emotional priorities often shift. These factors can all affect libido without indicating that something is wrong. It's also important to understand that sexual health looks different for every individual. For one person, masturbation may provide relaxation, stress relief, or a sense of well-being. For another, fulfillment may come from emotional closeness, affectionate touch, meaningful conversations, hobbies, exercise, spirituality, or other enjoyable activities. There is no scientific guideline that says older adults should masturbate a certain number of times each week or month. Instead of comparing yourself to others or worrying about online myths, focus on what feels comfortable, safe, and consistent with your own physical health, emotional well-being, personal values, and overall quality of life. Here's the expanded version of Keynote 2 in approximately 200 words, with no subheading and no ending sentence, as requested. Many older adults worry that if they stop masturbating, something harmful will immediately happen to their body. Fortunately, that fear is not supported by medical evidence. For most healthy people, choosing not to masturbate does not cause serious health problems or permanently damage the body. What usually happens is much simpler. You may experience fewer orgasms, and over time your sexual thoughts or urges may naturally become less frequent, especially as hormone levels change with age. Some people notice periods of sexual tension, occasional spontaneous arousal, or erotic dreams, while others barely notice any difference at all. Every person's body responds differently, and there is no single normal experience. Factors such as overall health, medications, stress, sleep quality, relationship status, and chronic medical conditions often have a much greater influence on sexual desire than masturbation itself. It is also important to remember that aging naturally brings changes in libido for both men and for women, and these changes do not automatically indicate poor health. Rather than worrying about the absence of masturbation, paying attention to regular physical activity, balanced nutrition, quality sleep, emotional well-being, and routine medical care will have a far greater impact on maintaining overall health and preserving a satisfying quality of life as you grow older. Here's the expanded version of Keynote 3 in approximately 200 words, but with no subheading and no ending sentence, as requested. One of the most common claims you may hear is that if you stop masturbating as you get older, your prostate will inevitably become unhealthy. the reality is much more nuanced. Some scientific studies have found an association between more frequent ejaculation and a slightly lower risk of developing certain prostate conditions, including prostate cancer. However, these studies show an association rather than proof that ejaculation directly prevents disease. Many other factors, such as genetics, age, body weight, physical activity, diet, smoking, and overall health, play much larger roles in determining prostate health. This means that choosing not to masturbate does not automatically increase your risk of prostate disease. Likewise, masturbating regularly should not be viewed as a guaranteed method of protecting the prostate. The best approach is to focus on habits that have consistently been shown to support long-term health. Staying physically active, eating a balanced diet rich in fruits and vegetables, maintaining a healthy weight, managing blood pressure and diabetes, avoiding tobacco, and attending recommended medical checkups all contribute far more to healthy aging. If you notice symptoms such as difficulty urinating, blood in the urine, pelvic discomfort, or frequent nighttime urination, discussing these changes with a healthcare professional is much more important than relying on myths or internet advice about ejaculation frequency. Here's the expanded version of *Keynote 4* in approximately 200 words, Kenton, with no subheading, and no ending sentence as requested. Sexual release can have positive effects on emotional well-being for many older adults, but it is important to understand that it is only one of many ways to support mental health. During orgasm, the body releases chemicals, such as endorphins and oxytocin, that may promote relaxation, reduce stress, and create a temporary sense of comfort and satisfaction. Some people also find that masturbation helps them fall asleep more easily or improves their mood after a stressful day. However, these benefits are not exclusive to sexual activity. Regular exercise, meaningful conversations with loved ones, laughter, creative hobbies, meditation, prayer, spending time outdoors, and maintaining strong social connections can produce many of the same positive effects on emotional health. Every individual experiences aging differently, and emotional wellness depends on a combination of physical health, supportive relationships, a sense of purpose, and healthy daily routines. It is completely normal for sexual interest to increase, decrease, or fluctuate over time, especially as hormone levels, medications, and life circumstances change. Rather than measuring emotional well-being by sexual activity alone, it is more helpful to focus on whether you feel connected, engaged, emotionally supported, and able to enjoy everyday life through activities that bring genuine comfort, fulfillment, confidence, and lasting happiness, regardless of whether masturbation is part of your routine. Here's the expanded version of *Keynote 5* in approximately 200 words, with no subheading and no ending sentence as requested. Many people believe that maintaining sexual function in older age depends mainly on masturbation, but the human body is much more complex than that. Healthy sexual function relies on good blood circulation, balanced hormone levels, healthy nerves, strong muscles, and emotional well-being working together. As people age, conditions such as high blood pressure, diabetes, heart disease, obesity, and sleep disorders can have a much greater effect on sexual performance and desire than the frequency of masturbation. Certain medications, including some used to treat depression, blood pressure, or prostate problems, may also reduce libido or make it more difficult to achieve arousal or orgasm. Fortunately, many of these factors can be improved through healthy lifestyle habits. Regular physical activity helps improve circulation, supports heart health, increases energy levels, and may enhance sexual function over time. Eating a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats provides the nutrients needed for overall wellness. Getting enough quality sleep, managing stress, limiting alcohol, avoiding tobacco, and maintaining a healthy body weight also contribute to better physical and sexual health. Instead of focusing on one behavior alone, caring for your entire body creates the strongest foundation for maintaining confidence, comfort, intimacy, and a satisfying quality of life throughout the aging process. Here's the expanded version of Keynote 6 in approximately 200 words with no subheading and no ending sentence as requested. When discussing masturbation in older age, it is easy to become focused on one specific habit and overlook the bigger picture. The most important question is not whether you masturbate regularly, occasionally, or not at all. The real question is whether you are taking care of your overall health in ways that support a longer, more active, and more fulfilling life. Healthy aging is built on many daily choices that work together over time. Staying physically active helps maintain strength, balance, mobility, and cardiovascular health. Eating a nutritious diet provides the body with the fuel it needs to support every organ system, including sexual health. Getting enough sleep allows the body and brain to recover, while managing stress can improve mood, energy, and emotional resilience. Strong social connections, meaningful relationships, and regular mental stimulation also play an important role in protecting cognitive and emotional well-being. Routine medical checkups help detect health problems early, making treatment more effective and helping preserve quality of life. If you have concerns about changes in your sexual desire, erections, vaginal comfort, or other aspects of sexual health, discussing them openly with a qualified healthcare professional can often lead to practical solutions. A balanced lifestyle that supports your physical, emotional, and social well-being is far more influential than any single sexual habit. Here's a compelling final conclusion for your speech. As we've explored today, one of the biggest myths about aging is that there is a single rule everyone must follow when it comes to sexual health. The truth is far more reassuring. Choosing not to masturbate in older age does not automatically harm your body, just as choosing to masturbate is not a guaranteed path to better health. Every person is different, and healthy aging is shaped by a combination of physical health, emotional well-being, meaningful relationships, regular movement, nutritious food, quality sleep, and appropriate medical care. The most important takeaway is to stop comparing yourself to myths, social media claims, or someone else's experience. Instead, pay attention to your own body, your comfort level, and your overall quality of life. If your sexual desire changes as you grow older, remember that this can be a normal part of aging. And if those changes concern you or begin affecting your daily life, don't suffer in silence. A conversation with a qualified healthcare professional can provide reassurance, identify treatable causes, and help you make informed decisions. Aging does not mean giving up on intimacy, confidence, or personal well-being. With the right knowledge and healthy habits, it is entirely possible to enjoy a fulfilling, active, and satisfying life for many years to come. Thank you for watching. And if you found this discussion helpful, be sure to share it with someone who could benefit from separating medical facts from common myths. Stay curious, stay informed, and most importantly, take good care of yourself.